Assalamualaikum. Now we come to the second part of our topic on introduction to family health. So since we talk about all these issues and challenges related to family health, so what does the role of the government? We try to address this problem by having a family health services. Earlier I said we started with maternal and child health. Yeah? Now the government in the middle of 1990s, we have expanded our scope of our maternal and health services to become family health services. So the vision at that time was to have a healthy, happy family and of course better quality of life. What was the mission then? Now having a vision, now mission, how we go about it? So we're going to provide a comprehensive, caring and professional family health services, which is equitable and acceptable by all communities. Just the government provide is not enough. We need community to be involved and also contribute by both providing individual and family health care. What the government does is to create awareness that health is an important asset. We need also a lot of collaboration between public, private and NGOs. First, we talk about maternal and child health, and we know that mothers and child make up about 2/3 of the population. So this MCH services is actually one of the big preventive health services that we already have. What is MCH? The definition in 1976 refers to the promotive, preventive, curative and rehabilitative health care for mothers and children. In our maternal and child health services, what do? We provide services for pregnant mothers, maternal health, for the child, also school-going age children, even now adolescent health, even for adolescents, and also children with special needs, disabled children and also family planning. MCH started from long time ago, before Merdeka, in 1956, just before Merdeka, and is still the main component of family health services. In those days, I got to tell you a bit of the history. I'm sure you learned this in management classes, but just a repeat for those people who are a bit foreign to Malaysian health services. Those days, we started with 3-tier system. We have a 3-tier health care delivery system, which is the main health center, then the smaller sub-center, and the smaller midwife cum quarters. Later we improve and upgrade the midwife cum quarters to become a clinic desa or community clinic. So we upgrade them, become 2-tier system. So we have one health clinic and the rest is the community clinic, which is also run by the midwife. In Malaysia, we deliver the health system beginning from the community clinic, the smallest unit, and the health clinic, which is a primary care clinic. In our health care system, we have the primary care facilities, secondary care and tertiary care. For the primary care facilities, we have the community clinic and the health clinic. Any cases that need referral, midwife will first refer. They are seen in the community clinic, the midwife will refer to the health clinic. And from the health clinic, if you need further treatment, it will refer to the next hospital. And should the patient require more sophisticated treatment, complicated cases, they will be sent to the tertiary care institution. Tertiary care, for example, like IGN, the National Heart Institute, the Respiratory Institute. Yeah? Coming back to our family health services, the family health services, where are they given? They are given in the health clinics, the MCH clinic, the health clinic and the outpatient clinics. So the maternal child health clinics are being integrated into the urban health services. They are given through the polyclinics and the MCH clinics. From maternal and child health clinic, MCH, we expanded the scope to become from womb to tomb. So under the expanded scope, there is comprehensive service scope inclusive of special population needs, like children with special needs, mental health, the elderly, even men. So family should include everybody. So we don't exclude men. From the beginning we are focusing on maternal and child health, but now all segments of society are included. Now, just like any program, health program, we want to promote and maintain the physical, mental and social health of the family. And specifically, if you look at this slide, the objective of the family health program is to promote and maintain health of women, especially women in reproductive age group, children and infants, adolescents, as well as men as well. Promote, maintain elderly of the family. So in other words, in general, we try to improve the health of our society, improve their nutritional practices, and improve their nutritional status. In other words, we provide comprehensive care. So how does we do this? At the national level, the Ministry of Health, we are the main provider of health services. Of course, services are also provided by the army, also provided by local authorities, and also some NGOs and private sectors. But the main lead agency is still the Ministry of Health. The family health section, at the national level, they have the maternal and child health unit, they have the school health, adult health, family planning, mental health, rehabilitation, and as well as geriatric and adolescents. The primary health care section, which was established in 1996, they also take care of all the polyclinics, health clinics, clinic desa, outpatient, and also the new traditional and complementary medicine unit. And the nutrition section has now become an independent division, and they help to promote nutrition, nutrition planning and rehabilitation. At the state level, we were talking about the national level just now. Now we are going to the state. The state, we have a maternal and child health officer and health matron. And what are the program strategies? There are many programs in family health. One of it is as you know, in the maternal and child health clinic is the antenatal, postnatal, perinatal care. We adopt the risk approach, safe motherhood projects, maternal mortality reviews, and alternating birthing center, ABC. Other programs related to school, like health promoting school, BBSS concept, and baby-friendly hospitals, and strengthening the family medicine services. This is the sample of activities that is being carried out in the family health services. It's important for you to compare what are the activities that we have here in Malaysia and compare it to your countries. We can share what activities may not be available in your country or the other way around. So it's good that you have a list down what are the activities that is being carried out in your country in terms of family health services and share it with your friends in Malaysia. Thank you very much.